Okay, friends, welcome back. We're moving into percussion. And honestly, this is one of those skills that most nursing students forget exists until about 3 hours before the exam. But percussion is actually pretty simple. We're basically asking one question: how much air is in there? That's it. How much air is inside the lung? Normal lungs contain air. When we percuss over healthy lung tissue, we hear resonance. Think hollow. Think drum. Think normal air-filled lungs. Normal amount of air. Normal sound. Now let's imagine fluid moves in. Maybe pneumonia. Maybe pleural effusion. Maybe pulmonary edema. The fluid replaces the air, and the sound changes. Instead of resonance, we hear dullness, because fluid doesn't vibrate the same way air does. Now let's go the opposite direction. Too much air, maybe emphysema, maybe a pneumothorax. Now we hear hyperresonance. More air than normal, louder than normal, more hollow than normal. Here's how I remember it. Normal air equals resonance. Fluid equals dullness. Too much air equals hyperresonance. That's basically the entire percussion chapter. Okay, friends, let's see if this is making sense. A nurse percusses over a patient's lung and hears a dull sound. Pause here and think about what that finding suggests. I'll give you a few seconds. Ready? Dullness suggests fluid or consolidation because something replaced the normal air in the lung, and that changes the sound. Okay, now we're finally at the section everybody thinks about when they hear respiratory assessment, the breath sounds. And honestly, this is where most students start trying to memorize things. I don't. I try to understand what's causing the sound, because once you understand the cause, the sound becomes easier to remember. Let's start with normal, because if you don't know normal, you'll never recognize abnormal. The most important normal breath sound is vesicular. Pronunciation: vesicular. Vesicular sounds are heard over most of the lungs. They're soft, they're low-pitched, and they're what healthy lungs are supposed to sound like. If you remember one normal breath sound, remember vesicular. Now let's talk about crackles. Every nursing professor describes crackles the same way: Rice Krispies. At this point, I think Rice Krispies should sponsor nursing school. Crackles sound like tiny popping noises, or Velcro being pulled apart. And here's what I think when I hear crackles: fluid. That's it. Fluid. Pulmonary edema, heart failure, pneumonia, fluid. A nurse hears crackles in both lower lung fields. Pause here and think about what findings should come to mind first. Ready? Crackles make me think fluid first, always. Then I figure out why the fluid is there. Let's lock this in. Resonance equals normal air. Dullness equals fluid. Hyperresonance equals too much air. Vesicular sounds are normal breath sounds. Crackles make us think fluid. And understanding the cause of the sound is much more powerful than simply memorizing the sound, because that's how real nurses think. In the next section, we're tackling wheezes, Rhonchi, pleural friction rubs, and some of the most commonly tested respiratory findings in nursing school.